my name is Dee Jones. Today is the 25th of September 2013 and this is my airway video. In this video I'm going to demonstrate putting a patient in the lateral position, the triple airway manoeuvre including the sniffing position, safely inserting an OPA or oropharyngeal airway and nasopharyngeal airway, using a laryngoscope and doing assisted positive pressure ventilation. Now I'm going to place the patient in the lateral position. This will help prevent aspiration in a conscious patient who can maintain their own airway, and it promotes flow of fluid or vomit out of the mouth easily. It's indicated if the person is conscious and can maintain their airway, and contraindicated if they have a suspected spinal injury unless deemed completely necessary. Placing the front arm forward and out, other arm across their chest, and their knee leg up. I'm going to pat their body down to make sure that there's nothing in the pockets, no hard objects or something. If there is something spiky though, it can actually go into your gloves, so you have to be quite careful. Then we're holding their hip and shoulder to maintain the neutral alignment of the spine, pushing over onto their side, bringing the knee leg forward and arm forward as well to maintain that they don't fall forward, and just maintaining the head forward and down to promote the fluid running forward. So now I'm going to demonstrate doing the triple airway manoeuvre, which involves the sniffing position. This is indicated on an unconscious patient when you're wanting to assess their airway patency and to check if there's anything occluding. It also pulls the tongue out of the way of the oropharynx and clears the airway. So what you're going to do first is put your patient in sniffing position. You're going to put a 2 to 3 centimetre pad under their head and lift their head forwards and upwards. You're just going to try not to hyperextend the neck, which may actually occlude or kink the airway itself. Then you're going to place your left hand on their forehead and your right hand pistol grip on their chin. Bring the head back. You're going to lift the chin vertically. This is your chin lift. Then you're going to place your third, fourth and fifth fingers on their mandibular bone, and you're going to place your second fingers on the mandible and your thumbs on the zygomatic bone, and then you're just going to do a chin lift and lift the chin up and out, clearing the airway and pulling the tongue away from the oropharynx. Now I'm going to demonstrate inserting an oropharyngeal airway or an OPA. This is indicated when the patient is unconscious, doesn't have trismus and doesn't have a gag reflex. If they do have a gag reflex, this can increase intracranial pressure. So you're going to measure it by placing the top near the patient's mouth and the bottom to the angle of the mandible. If it isn't the right size, it's not going to do the job of sweeping the tongue away from the oropharynx. So to insert, you're going to lubricate with the patient's own saliva, and then placing upside down at first, you're going to twist 180 degrees until it's in the patient's mouth. I'm going to demonstrate inserting a nasopharyngeal airway or an NPA. This is indicated on a patient that has altered consciousness and trismus, and is contraindicated if they have a middle third facial fracture, any cerebrospinal fluid from the nose or mouth, has a significant nasal trauma, or has a traumatic brain injury. So to do this, you're going to measure from the tip of the nose to the lobe of the ear to get the right size. If it's the wrong size, then it's not going to do what's indicated by creating a clear airway. And what you have to do is lubricate it with KY jelly. In this case, we've used silicone lubricant on the mannequin. And what you're going to do is, starting from a right angle, you're just going to spin the NPA until you get into the measured end. Now I'm going to demonstrate doing positive pressure ventilation. This is indicated for a patient who has a decreased respiratory rate or isn't breathing. What you're going to do is grab your oxy-saver, and using the closed circuit positive pressure ventilation system, you're going to put the mask on the patient's face, creating a nice one-handed C-hold seal. And using the 2-litre bag, you're going to ventilate at a rate of 10 ml per kilogram for the patient. So if this was a 60 kilogram patient, I'm going to ventilate for 600 ml per breath, which is about just over a quarter of the bag. I'm going to demonstrate doing the laryngoscopy. This is indicated on an unconscious patient with no gag reflex to inspect the upper and lower airways. First of all, you're going to check that your bulb is on tight and it's bright, so it's not going to fall out. And then you're going to insert it into the right side of the patient. just checking the upper airway at first. If this is clear, then you're going to push it down into the vernacular groove, sweeping across to the left to sweep the tongue out of the way. And you're going to pull it down so that you can see the patient's lower airway and vocal cords. Things that can go wrong with this is if you're going to lever it up and you can break the patient's upper teeth, or if you're too rough with it, you can sever the patient's epiglottis.